Hello there. Are you comfortable? Good, good. My name's Dr. Sarah. Could you just confirm your name for me? That's perfect. Okay. So I'm just taking a look at your notes here, and you're here to have an ear cleaning today, yeah? Okay, you've been having a lot of problems, yeah, and pain. Okay, so my associate has sent you to me to have them cleaned. Perfect. Okay, so how do you feel today? Okay, so you got some pain and discomfort in the ears, yeah? Okay, and you've had it for a little while now, haven't you? Alright, okay. You don't have any temperature that you know of? No, had no cold recently? Okay, that's fine. I will take your temperature anyway, just to make sure. Yeah, okay. So before I decide how I'm going to clean your ears, I need to have a look down your ears first, okay? And I'll be using this otoscope here, which I know you've already had down your ears many times because you've had a few problems in the past, haven't you? Yeah. Okay, my lovely. Well, don't worry. I'll work out the best and most comfortable method for you. All right. Okay. Right. I just need to get some gloves on. There we go. And just check the notes there. You're not allergic to anything, are you? No, that's good. Okay. So what I'm going to do first is have a little look down your ears, alright? Okay. I'll just make sure my light's nice and bright there. Okay. Perfect. That's perfect. Okay. So I'll just need to pull up and back on your ears a little bit just so I can insert this otoscope. Alright, my lovely. Tell me if it's uncomfortable. I know it's going to be a little bit painful for you because of the inflammation in your ears, but I just need to take a look first so I know what I'm dealing with. Okay, alright. I'll start with your left ear first, my lovely. Okay. Right then. So I'm just going to pull up and back and just gently insert the otoscope. Well done. Okay. Right. Yep, there's a complete wax blockage there. Okay. Very inflamed from the pressure of all that earwax. I can't see your eardrum, so we really do need to make you more comfortable, don't we? Is that a little bit sore? Okay. Sorry. Being as gentle as I can. I'm just going to reposition it a little bit. Okay. Alright, I'll just take that out of there now. Okay. So that was a bit sore for you, wasn't it? Okay. I'll just take your temperature in this ear while I'm over here because this is the side my thermometer's on, so you just hear a couple of beeps, my lovely. I'm just going to, again, just gently insert that into there. Okay. Alright. That's fine. Okay. So no temperature. Okay, let's get rid of that. Right. Let me take a look in your right ear now. See what we're dealing with here. Same again, just going to pull up and back very, very gently. There we go. And insert. Well done. Okay. Same again, can't see the eardrum at all. Lots of wax and lots of redness. Okay, right, let me withdraw that. Your ears are really, really inflamed, as you can probably tell. So what I'm going to do first is I'm going to pop a cover on each ear, around the ears, to stop any spillage coming down, and I want to just pop some anesthesia drops in, okay? That will make things feel so much more comfortable for you. Alright, they feel a little bit cold in your ears, but what I don't want to do is just go in there and start messing around without making you feel as comfortable as possible. Alright, and then what I'm going to use afterwards is a very, very different type of eardrop. They're strong, but they won't burn. They cause fizzing, crackling sensation in your ears, so you'll hear the sound, but they eat through the wax very, very quickly. Okay, so let's get on with those anesthesia drops, my lovely. Okay, and let's get you feeling more comfortable. Right, so I'm just going to pop a cover around your ear, okay? There we go. Keep you nice and protected. Don't want you getting all messed up there. Okay. Gently round there. Okay. That's lovely. Make sure you're all nice and covered. Right, okay. So, I just need to give these a really big shake. If we don't have total success by doing this, I will refer you on to an ENT specialist, okay, who may need to look at things further, because I can see you've had problems with your ears before. Okay, sometimes people get recurring issues with this. You don't put cotton wool Q-tips down your ears, do you? No, okay. Do you wear headphones a lot, as in earbuds? Right, okay, because that can cause a lot of earwax build-up as well. Do you wear earplugs at all? You do sometimes for your job, right, okay. Again, that can cause an accumulation of earwax and obviously more chance of infection. Okay, things we have to consider. Right. So these, as I said, are going to feel a little bit cool. But it will make things feel comfortable. Alright, keep your head nice and still for me, my lovely, okay? Thank you. Alright then. Here we go. So, just a couple. There's one. Okay, and there's two. Perfect. Okay. Just wanted to make sure it wasn't dripping out anywhere where the cover wasn't protecting you. Okay. Let's go with this side. Okay, nice and still for me. Okay. There's one. And two. Perfect. Okay. How does that feel? Nice and cool. Okay. They should go quite numb very quickly, but I will just check it. Okay. I'll just use one of my tools. I'm just going to gently touch your ear canal, and I want you to tell me if you can feel anything, okay? Right. Perfect. Okay. Can you feel anything? No? There? No? Okay, so your left side's nice and numb. Let's check this side. Can you just tell me if you can feel this? No, that. No. Okay, I'm happy with that. Okay, so before I begin, at any point if you do feel discomfort or you go dizzy or anything like that, please just pop up your hand. Please don't move your head because that could cause a few problems for me. Obviously I'm going to be working down the ear canal. So I'm going to be using a selection of tools which I think are going to be best for this job. Okay, I'm going to show you here. So just little spoon-shaped tools. Okay, and this one's got loops on it, and sometimes that's really useful for scooping earwax out once it's been softened by the drops. Okay, don't go too near to the eardrum, but just on the outer bits of the wax start scooping. It can help lift it away and then can clean more with these afterwards. Alright, okay, just like to show you what I'm doing, and unless I think of anything else that I need to use, this is all I'm going to be using. Okay, alright, okie dokie. Right, just give me a minute and I'll get those fizzy drops ready. I just need to mix something up and then we'll get you all settled and fizzing nicely for me to clean out that earwax, and we'll see what's going on then. Okay? Alright. Okay. Right, so I've got my special fizzy drops all mixed up now. Okay. So again, I just need you to stay nice and still for me, my lovely. Alright? And I'll get these down. I'll probably need to put about 4 drops down each ear. Okay. No, it won't hurt at all. It'll feel quite pleasant. And you'll get these lovely fizzy crackly sounds, promise. Okay. Alright then, so let's start with this left ear again. Again, tell me if there's any discomfort at all, won't you? Okay. So here we go. Here's 1, 2, 3, and 4. Okay. Starting to fizz now? Good. Okay, and here. And 1, 2, 3, and 4. Okay, wonderful. Okay. You okay there? Good, good. Right, I'll just update this a second while you're having a fizz. Alright then, so I'm going to take another look gently with this otoscope again, okay? These drops do work very quickly, so I'll be able to see if they've started to melt that wax away. They should have done. Alright, okay. Keep nice and still for me again, my lovely. Just going to pull up and back like a ball. Okay. There we go. And inserting that. Just a very quick peek. Okay, that's lovely. That's lovely. I can see that that wax has melted now. At least on the outer part. We'll see what's behind. Okay. Lovely. Let's withdraw that now. All good. Okay. So now I just need to find my cloth. There we go. So again, keep very still. If anything is uncomfortable, tell me. Okay, I'm just going to do some very gentle picking with the 3 tools that I showed you earlier. Alright? Okay. And let's see if we can't remove all this awful earwax. Okay. Perfect. Here we go then. Okay. Is that okay for you, my lovely? Good. Change the tool. That's coming out really, really well. Okay. Alright. Just changing tools occasionally. Ah, that's got it. That's got it. I think that was a big piece that came out. Those drops are amazing. Okay. How are you feeling there? Good. Right, I'm just going to check down your ears with the otoscope again, my lovely. Okay. Very gently. Tell me if anything's uncomfortable with you. Okay. There we go. Right, I can see the ear canal. Looking better. Still red, but that will last for a little while. But I can see the eardrum now. A little bit of wax in there, but I'm going to leave that because that's normal. That's lovely. Okay. Lovely. I'm super happy with that. Right then. Let's get to work on this side. Okay. Nice and relaxed. Good. Okay. Let's see what we can do here. Okay. There we go. This has been wonderful because once the initial outer parts of the wax build-up were taken away, the bit behind has actually come away very, very easily. Perfect. Okay, that's lovely. Okay, just going to take a look down your ear again. Nice and still again for me. Perfect. There we go, just pulling up and back a little bit. Just pulling up and back. There we go. Alright. Excellent. Yeah, okay, you can see the eardrum now. That's wonderful. Just a little bit of earwax I'm happy with that now. I don't want to poke around too much because they've been very sore. Right, okay. That's perfect. You've done really, really well, my lovely. I know it's not the most comfortable thing to have done, but I hope that you didn't feel any pain there. Good, good. Right. Because the ear canal is so inflamed from all that build-up, yeah? I'm going to put some more drops down your ears, okay? They're an anti-inflammatory drop. I'll give you a prescription, okay, for these. You can use them for a few days just to help calm that pain down, okay? And you can take regular painkillers like paracetamol as well. Yeah, they're going to feel sore just for 2 or 3 days, okay? But it will go down. A lot of your discomfort has been from that inflammation of the canal wall because of the build-up in there. All right. Okay, right. That's fine. My other drops. Okay. I'm going to give these a nice big shake as well. Your ears will still be numb at the moment. That will wear off in the next hour, all right? Okay. All right. Let's do this side first. Okay. Okay, just 2 of these drops at a time, okay, in each ear. You'll need to do this 3 times a day, but it'll all be on the packaging when you get your prescription from the pharmacy. Okay, here we go. 1 and 2. There. Okay. These won't cause you any problems, I can assure you. Okay, let's pop some in here. Right, and 1 and 2. There we go. Oh, good. Just going to give that a little wipe. Give your ear a little wipe now. Okay. Give your ear a little wipe on this side. All good, right. Let me remove these covers. Okay. All done. Okay. Perfect. Right. It feels better already. Wonderful. That's what I like to hear. So I'll just do that prescription for those drops. Send it straight to the pharmacy for you. Any problems, if you notice anything in the next few days that seems untoward, any discharge, feeling unwell, please just call us back, okay? If it's out of hours, you can go to A&E or an urgent care centre, alright? Okay, and that's 2 times a day. Okay, that's all gone to the pharmacy for you now. Alright, I'll make you an appointment to get you back in next week. Okay. Are you free a week today? What time suits you? I've got 10:30 or 2:20. 2:20, okay. Let's pop you in there then. I'll see you next week unless of course there's a problem. Okay. So you're feeling okay? You're not dizzy or anything like that, no? Good. Okay, so remember, use those drops and just take paracetamol if you're feeling extra uncomfortable. Yeah? Okay. You'll be fine, you'll be fine. Obviously, just be aware of any problems and report them if you do feel anything unusual. The soreness, as I said, will take a couple of 3 days to go away. Okay then, my lovely. Alright. I'll pop to the pharmacy and the prescription will be waiting there for you. Alright, so you take care. Take it easy for the rest of the day. Alright. Bye-bye.